Hello, my name is Dr. Jasmine Patel. I am an obstetrician and gynecologist and family planning specialist who works at the University of California, Irvine. Today, I'm excited to talk to you about female birth control, part 2, birth control or contraception. This presentation is part of a series of presentations on reproductive health issues on the ReproNet channel. Subscribe to the link below to learn more. Birth control or contraception works to prevent pregnancy and can affect your menstrual cycle. When you do not want pregnancy, there are many different types of options for birth control. They require a different amount of work on your part or for your partner. There are natural methods, non-hormonal methods, and 2 different kinds of hormonal methods. Let's start off by talking about non-hormonal methods. Birth control methods that do not use any hormones include pulling out, diaphragms, condoms, copper IUDs, and permanent sterilization. Pulling out or withdrawal is when the man pulls out his penis right before he finishes or ejaculates inside the woman. If he is good at doing this, it can work well to prevent pregnancy, as the sperm cannot be in the vagina. But it is not as reliable if he does not pull out in time. A diaphragm is a device you cover in spermicide and place in your vagina, covering your cervix before every active intercourse. You must then leave it in the vagina for 4 to 6 hours after intercourse before removing it. It acts as a physical barrier to prevent sperm from getting up into the uterus. A male condom fits over the penis and requires the man to put it on before intercourse. A female condom fits in the vagina and requires you to place it before intercourse in your vagina. Both can be used once and should not be used together. An IUD is an intrauterine device that goes in the uterus. There are little strings that stay in your vagina to help your doctor remove the IUD when you want to take it out. Your partner should not feel those strings, but if he does, it could be cut shorter. A copper IUD is an IUD that has copper wire on it. Copper kills sperm very well. A doctor or nurse must place this device inside your uterus at an office visit. It is safe for any woman to use even if they were never pregnant or had a vaginal delivery, if they are a teenager. It is good for up to 12 years, but can be taken out whenever the woman wants, if she doesn't want it or like it or wants to become pregnant. Sometimes your periods can become heavier or more painful, but you will still get them when you normally do. There are 2 permanent methods of sterilization. These are good options for women who are sure they no longer want to have any more children. A tubal ligation involves a surgery in the operating room to remove the tubes from a woman and their uterus that prevent pregnancy. You will still get your period normally, but will not be able to get pregnant. Alternatively, your partner could get a vasectomy, where the tubes that bring sperm from his testicles are cut. This is a safe and effective procedure that can be done in the office. It does not affect his manliness or his ability to have sex. Let's test what we learned. Which of the following is not a non-hormonal method of contraception? That's correct, pills. Pulling out, copper IUDs, and a tubal ligation are all non-hormonal methods of contraception. Now let's talk about the hormonal methods to prevent pregnancy. The birth control methods that use 2 hormones include the pill, the patch, and the ring. The pill is something that you would take every day and can have bleeding once a month for a few days when you use the different color pill. Alternatively, you can take the pill in a way so that you can skip your period if you wanted to, and that is safe for you. A patch is a sticker that you place on your skin and will replace every week, and also has 2 hormones that go through your bloodstream. A ring is a flexible, soft ring that you put in your vagina every month and absorbs hormones through your vagina. With these methods, you can choose to have a period or not. It is not unhealthy to not have a period when you are using birth control. Instead of losing this blood, it goes to your brain and your heart and the rest of your body to keep you healthy and prevent anemia. These methods can also help reduce other symptoms you have with your period, like acne, pain, heavy bleeding, or bloating. The birth control methods that use one hormone include pills, the shot or Depo-Provera, the hormonal IUD, and the arm implant. The one hormone pills are the same every day and are a very low dose of medicine. This means you have to take them at the same time every day or else you can get pregnant. They are very safe and most women can use these. The shot can be given in the doctor's office every 3 months, or you can give it to yourself at home every 3 months. The hormonal intrauterine device, or IUD, is a form of birth control with a small plastic T device and a small amount of hormone. A doctor or nurse may place the device inside your uterus at an office visit. It is safe for almost any woman to use, even if they were never pregnant or had a vaginal delivery. It's good for up to 7 to 8 years, but can be taken out whenever the woman wants if she doesn't like it or wants to get pregnant. The implant is a form of birth control that is a small plastic rod with a small amount of hormone in it. A doctor or nurse must place the device under the skin in the upper arm at an office visit. It is safe for almost any woman to use. It can be used for up to 5 years and taken out whenever the woman wants if she doesn't like it or wants to become pregnant. The one hormone methods can change the way your period comes. It can make you have lighter periods, no periods, or irregular periods. It is okay for this to happen. It is not a problem. These methods prevent pregnancy by thickening the cervical mucus and the opening to the uterus to not let sperm in. They also make the lining of the uterus thin, which is why not having a period can be normal. Where is an IUD placed for birth control? That's correct, in the uterus. Anybody have any questions or comments? Thank you for listening. Have a great day.